Welcome back. Well, today we are talking about how to make the most out of old age. Life expectancy continues to increase, and there are things you can do to live a long and healthy life. To learn more, we have Dr. Furman here from UofL Health. Thanks so much for coming on today, Dr. Furman.
You're welcome. You're welcome.
So we've got to start with this phrase, optimal aging. What exactly is that?
Yes, we thought long and hard about that, and so we don't want to say successful like you pass or fail. So optimal aging is what it's individualized, but it's really about physical health, mental health, and social health. So physically, moving, you don't have to exercise, just moving. Cleaning your house can be, movement. And then it's all about nutrition, and what you put in your mouth matters. And so if we really want to optimally age, you have to think about what you eat and how you move. And then the mental health, the behavioral health, your anxiety, depression, making sure you're addressing that. And then the social determinants of health, where you're around people, communicating, having relationships. They've talked about smoking 16 cigarettes a day it takes years off your life, So I'm sorry, I said that wrong. So what I meant to say was, if you don't have social engagement, it's like smoking 16 cigarettes a day. That's what I meant to say. So the social aspects of aging is important, right? So you need to be around people. So the isolation, especially during COVID, like the social isolation was like smoking 16 cigarettes a day.
Oh, wow.
So we want people to think about their physical health, their mental health, and their social health. And it's all very important.
And what are some of the tips you suggest people? You said cleaning your house.
Yes.
That's such a good one.
Yeah.
Any other ideas like that?
Right. So you have to make an effort, to stay engaged and make an effort to know about your own health. So health literacy is important. So, talking to your doctor, talking to your provider, sometimes it's a nurse practitioner, and making sure you know what every medicine is for. What we see a lot to help you age optimally, you need to be on the least amount of medicines. And I hate to say that as a doctor, because the doctor's always prescribing medicines, but sometimes stopping medicines is important. And for patients and people to know about their own health. Like, why am I taking this medicine? What's it for? Do I really need it? So owning that yourself, and owning it is about staying engaged in your health. So we recommend the physical, the mental, social, knowing your medications, and keeping up with your provider. So some people don't ever go to the doctor until they're sick, and so part of optimally aging is being proactive. So getting your colonoscopy if you need it. Your mental health, people have dementia as they age, and you can do some things. It's really not dementia. Maybe it's actually medication. So there's things that you can do and to be proactive about it, not just waiting for bad things to happen.
Well, excellent advice here. Things that people can certainly take away here. That's what we'd like to give them. Thank you so much for coming on, taking some time with us today. You leave people with some great advice here. We appreciate it.
You're welcome.